Good afternoon. How are you doing today? My name is George Jaramillo, and this is a presentation on a quality improvement project on the effectiveness of mindfulness-based interventions versus lemon oil aromatherapy to help reduce cognitive test anxiety among SRNA students. My faculty that helped me with this project was Dr. Yvette Hidalgo, and my clinical mentor was Dr. Yasmin Campbell. I appreciate them both for helping me along with this project and giving me their guidance and input. So some of the learning goals for this project is going to describe the impact of cognitive test anxiety on nurse anesthesia residents, compare and contrast the evidence-based interventions to reduce cognitive test anxiety, and then identify the benefits on lemon oil aromatherapy and mindfulness-based interventions. A little bit background on the problem. Cognitive test anxiety is a mix of emotional and physiological responses that impact performance. There is a high prevalence of cognitive test anxiety among nurse students that lead to stress and reduced academic outcomes. Benefits of a lemon oil aromatherapy. Some of the evidence-based interventions with lemon oil aromatherapy show that can provide an immediate reduction of the physiological anxiety symptoms associated with test anxiety, such as tachycardia, hypertension, diaphoresis. It is a non-toxic approach, cost-effective, and easy to implement. It is also effective in short-term high-stress scenarios. So what this means by being non-toxic, it is that it's something that is very easy to implement. You can use it two different ways. You can use a diffuser, such as like a little apparatus that is going to you insert a couple, 2 to 3 drops of the lemon oil aromatherapy, and it diffuses it into the air. Or you can use a lemon oil inhaler. This is something that has lemon oil already installed in it. You take a couple puffs of it before an examination, and this has been shown to reduce the test anxiety. Lemon oil aromatherapy is also very cheap, so that why is a cost-effective approach and easy to implement. And it has also been studied. And among this research paper, I found that it was very effective in the immediate short-term scenarios. So, for example, in our situation where we're discussing SRNA students, this is something that could be easily implemented right before an examination period. The instructor could have a diffuser already in the room for the students going. So right while they're taking their exam, they're experiencing some of the benefits of lemon oil aromatherapy. Or if that's not applicable, the student could have a personal inhaler device with them ready to utilize right before an examination or even in the clinical period. Benefits of mindfulness-based interventions. One of the strong aspects of mindfulness-based interventions is that it promotes emotional resilience and also long-term stress management. It builds by building upon those long-term coping mechanisms. It helps to reduce chronic anxiety over a long period of time. It can be incorporated into both academic and clinical settings, and there's several different modalities that can be utilized. Something called a coloring mandala, a guided meditation, visualization, and cognitive reframing. And I'm going to go over each of these in a little bit more depth. So what a coloring mandala is exactly is and visualize what a stained glass window would look like at a church. That's kind of what a mandala is. It has a lot of intricate little pieces that allows the person that is currently performing the task to focus on coloring. Oh, I got to color this little square or this little circle over here. So what that is doing is it is putting the person currently present in the moment, and that is a task that they're focusing on. By allowing that person to focus on the current task, it helps to reduce their anxiety because it is allowing them to cognitively remap the way that they're thinking. They're thinking only currently about, I got to color this photo. Once I'm done coloring this photo, then I move on to the next task. It allows you to have a sense of presently awareness, but it is also something that has to be practiced consistently, and it's not something that can just be utilized. Oh, I'm going to do it today and not do it tomorrow. You have to benefit. The benefits of mindfulness-based interventions is over the long-term course. So by utilizing things as other aspects of it, such as the cognitive reframing, and allowing yourself to be present in the moment, you have to constantly tell yourself, I can instead of I can't, or I will instead of I won't. These are aspects that allow the participant to really utilize and benefit from mindfulness-based interventions. Also, the aspect of visualization. This is something that is not easily obtained. You have to have the participant have a little sense of self-discipline by allowing themselves to visualize the goal. For example, graduating in 8 months, I am visualizing me passing, I am visualizing me on that stage with my professors and all my fellow classmates and walking across that and getting my diploma and successfully completing my CRNA program. This is a sense of visualization. This is something that I have practiced over the course of the last 3 years. It is not something that I practice just today. It is something that I practice every single day. By constantly reinforcing that aspect, I am allowing myself to have an internal belief and guidance and discipline that allows myself to realize this is my goal, this is what I will attain. And then also guided meditation. This is something that not everybody could easily do. Guided meditation is you sitting and focusing on, whether it be box breathing or looking at a photo of a dove on a tree and just visualizing that by itself. That is something that not everybody is easily able to attain because they have to sit there and be present in the moment. People have kids, people have very busy lives, and they may not have those 2 to 3 minutes even to themselves on a daily basis to implement that guided visualization. So a little bit more education on the problem. Lemon oil aromatherapy in comparison to mindfulness-based interventions and how this can help to reduce the cognitive test anxiety amongst nurse anesthesia residents. Some of the evidence-based interventions, one of the things that I found during my research is that lemon oil aromatherapy actually contains something called D-limonene, which this is the component of the essential oils that helps to actually reduce that anxiety symptoms. Mindfulness-based interventions is the guided meditation, visualization, and then cognitive reframing. Both methods have been shown to show potential for immediate and long-term relief during decreases of cognitive test anxiety in high stressful situations. So a little bit of the intervention details is you'll be conducting a pre-survey. This will have some demographic questions asking your age, your gender, a little bit of your background, how long you've been in the field. And then this virtual education module you'll be able to access from your phones or the computer. The ratio will be no longer than 10 minutes. Delivery is going to be a research as a voiceover PowerPoint presentation, a little bit of information on both lemon oil and mindfulness-based interventions and their clinical practice. And this can be delivered to you online via email, so it can be done anywhere virtually. So the virtual education module for mindfulness-based interventions is going to, like I've been doing, showing you virtual instruction on the mindfulness practices, understanding what guided meditation is, visualization, and that aspect of cognitive reframing, and the benefits of mindfulness for managing stress and improving focus, and practical examples of mindfulness techniques, and video and resources for guided mindfulness exercises. The effectiveness will be significant reduction in test anxiety with consistent practice. While there is a lot of research gaps to show high dropout rates in long-term programs, this could be suggest as challenging and sustaining engagement, and limited studies on nursing students and practicing nurses. So one of the things with mindfulness-based interventions is a lot of these research studies, the students didn't have the discipline to continue to maintain this even over the course of a couple of months. So they would have a high dropout rate. So the attainability number and the actual results are kind of skewed because you would have to have somebody that is able to effectively maintain an art of self-discipline to be able to perform this. Whereas lemon oil aromatherapy was having immediate short-term relief, and this was a little bit more easily researched. So education on lemon oil aromatherapy would be the theoretical use of lemon oil aromatherapy for reducing test anxiety. And then the virtual module will discuss the mechanism and of action of D-limonene that helps to reduce that stress anxiety, case studies, and research evidence supporting lemon oil aromatherapy, and a step-by-step guide on how it can be used. The effectiveness will be an immediate relief demonstrated in the research studies, and the research gaps show limited studies on the long-term benefits. Lemon oil aromatherapy is something that could be implemented more so directly right before a high stressful environment. So having the inhaler with you or the diffuser, using it right before the examination period has shown to be effective in the acute scenario. Integration of both interventions is potential for complementary use. Aromatherapy, like I said, for an acute relief, and mindfulness-based interventions for more sustainable long-term anxiety management. Future research could explore integrated methods, but currently these have not been compared and contrasted. They have been researched independently. Implementation into practice and its implications. So implementation will be institute has an inhaled aromatherapy and a simple mindfulness-based intervention activity prior to an exam to help reduce cognitive test anxiety. The implications could be CRNAs can benefit from cognitive test anxiety reduction strategies to help alleviate this anxiety and their physiological symptoms, as I mentioned before, the nausea, the tachycardia, the hypertension, or that mind fog, the loss of short-term memory recall that some students even experience in the clinical setting. And then the positive outcomes can be disseminated, supporting the use of lemon oil aromatherapy and mindfulness-based interventions for cognitive test anxiety reduction in nurse anesthesia residents. A little bit of take-home summary. Cognitive test anxiety significantly affects academic and clinical performance. Lemon oil aromatherapy provides more of an immediate relief, whereas mindfulness-based interventions provide a more long-term benefit. Both methods are evidence-based, cost-effective, and applicable to nursing education and its practice. Combining these interventions can create a robust strategy to help reduce stress management and anxiety in nurse anesthesia residents. Cognitive test anxiety is a critical issue for nursing students and healthcare professionals. Research-based evidence supports the use of both lemon oil aromatherapy and mindfulness-based interventions to reduce anxiety. Practical implementation in high-stress environments can help to decrease cognitive test anxiety, such as nurse anesthesia students right before an exam period. And these are my references. Thank you so much for your time.